It's my feel-good breakfast show.
Welcome back. You are live with Expresso as we close out Movember. Yes, a very important month of awareness in November. Let's talk about it right now. Prostate cancer is ranked as one of the most common cancers amongst men, both locally and globally. The month of November shines the spotlight on prostate cancer awareness and how it can be treated in the early stages. But it's not limited to only this month, as men are always in need of being proactive about our health, and we need to be aware of the warning signs. Specialist urologist, robotic and transplant surgeon, Dr. Anesh Naidoo now joins us in studio this morning to tell us a little bit more about prostate cancer. I want to say this would normally be quite a difficult conversation, but hopefully now, after a few iterations of Movember, we've become comfortable enough to go and get tested. I'm actually going this week to prove that point. But Doc, great to have you here. Maybe we should start with the most obvious question. What is prostate cancer specifically, and how common is it? I mentioned that it's very common locally and abroad. How common is it?
Yes. So prostate cancer is basically a tumor involving the prostate gland. And, the common question is, what does the prostate gland do? Well, it's a gland that's involved in your reproductive function. And how common is it? Well, about 1.5 million new cases in the world per year. Okay. And the incidence varies depending on which region of the world that you're in. But it varies from 15 to 110 new cases per 100,000 people per year.
Wow.
Yeah.
That's incredibly common. Are some men more prone, more likely to be diagnosed with it? Are there influences? Is it purely genetic?
Yeah. So in terms of this is the second commonest malignancy in men, and clearly there are risk factors. So if you have a family history of prostate cancer, if you have a father who's had it, then your risk is increased twofold. If you have a father and a brother, then your risk is increased fivefold.
Gee.
If you have a father and two brothers involved, then your risk is increased sevenfold. So there's a strong genetic link. And then there's certain racial variations and geographic variations depending on which part of the world that you live in. So a country like Japan has a low incidence versus North America or Western Europe that has a high incidence. And the mortality rate actually varies according to racial groups as well. There's a far more aggressive course of the disease in people of African descent, which we are well aware of here.
Sure. So it makes the relevance of Movember here in South Africa even more impactful. When should I start getting tested? Is it an old man's gig?
Well, so if you have a family...
When I say old man, I'm talking about myself here. Yeah.
Well, whom should be tested? People who have symptoms, So if you have any kind of voiding symptoms, any issues such as erectile dysfunction, you should get tested regardless of your age. And the general screening guidelines are men 45 years and older. Particularly if you have a family history of prostate cancer, then one should be screened.
Warning signs, you mentioned obviously when it comes to issues in the bed, it's going to be a first warning sign there. What other, is there a test that you can do yourself?
Well, most men are asymptomatic. You have no symptoms. And the ones that do have symptoms, they usually have voiding symptoms, which can be urinary frequency, urgency, a reduction in stream, waking up at night to void. And in later stages of prostate cancer, then you have symptoms such as weight loss and backache, bone pain, etc.
It's treatable. And this is, I think, the message that we're trying to get across, that if you find out about it early enough and act. So how do we treat prostate cancer?
So indeed, it is very treatable, provided you discover it at an early stage. So the aim of screening intervention is to detect at an early stage where the disease is localized. If it is localized, then there are various forms of treatment that can be offered that are quite effective in actually curing people from prostate cancer. So although we see an increasing incidence worldwide, but the mortality rate of the disease is actually declining. Brilliant. And is mainly due to screening. Screening itself reduces the risk of prostate cancer-related mortality by at least 25%.
Wow. So, gents, I think you can take home the message in that. We've had a question come through this morning from Josephine Pigstone, who's asking, and I suppose this is quite a good question. She is asking, can men get menopause?
Yeah, well, it's called menopause.
Menopause, exactly.
Andropause. So absolutely, as you age, your testosterone levels fall. And so if they fall to a level where you start to have symptoms of testosterone deficiency, then you actually do have it. And for those men, we offer them hormonal replacement, like the way you would do in women.
With women, eh?
You actually have the same situation in men. And it's, if they do have the replacement, it's life-changing for them.
Josephine, thanks for making every guy out there a little bit more insecure. No, we really do appreciate that, Doctor. We appreciate your time this morning and the work that you do every day for men. I think that's something that all of us need to take on board, not just in November, but throughout the year. Look out for those secondary signs, yes, but if you're a man of age, just go and check, because early detection is probably the most important factor. To all the men out there, we need to be proactive about our health and look out for the signs and symptoms, yes, and this could be crucial in saving our own lives. In fact, I am going to go and get tested this week.